from the vertebral column and from the foot. So the joint receptors, the muscle spindles and Golgi tendons of the deep musculature around those bones is a particularly important rich afferent source to turn on this system that demands of anti-gravity activity. So therein is a basis for treating the foot to allow it to be dynamic, to adapt to the floor, to receive the afferent input through the receptors, to turn on a system that produces the extension through the lower limb. Okay, now the next slide, I hope, is going to be a movie. And so keep your eyes on the screen and at the same time your eyes on this page. And what I thought is, rather than just saying a list of questions, right, these are some of the things that you might look at. I'm going to be so excited if this works. So this is a patient in the clinic. We're going to look at him try to get up. I think he goes back down again and walk. Now, taking the information that I've said, I'm going to scoot back here. In terms when he gets to walking, well, first of all, when he gets to standing, I should say, you can see that he has a lot of effort, doesn't he? He can't actually get his center of mass forward. And so this upper limb comes in to help him achieve getting upright. So there's an inefficiency in his postural control so that he needs to use the upper limb as part of sit to stand. When he walks, going back to central pattern generated, the clinical questions, you want to consider, does he have intact central pattern generators? Are the issues predominantly that with inner limbs? So would you seek to change the swing phase and the stance phase through this one limb? Or is it actually the lack of appropriate stance through the left that doesn't allow the swing of the right? So is it an interlimb or intra-limb issue? In terms of postural stability, so does he demonstrate APAs to cope with the postural disturbance? Or is the involvement of this upper limb something that he's utilizing because of his inefficiency in terms of postural control and APAs? Is the foot, now you can't see it through the shoe, but is the foot to ground response dynamic? So is he able to access the vestibulospinal system as efficiently as possible to allow him to create the stance phase and locomotion? What would be the influence if you gave him a gait aid? How would that impact his central pattern generators? Right. So there's some of the clinical questions that you might ask as a result of this information. Last but not least, and this is quite brief, adaptation. So how do we adapt to the environment? Really, there's two descending systems that allow adaptation. One is the corticospinal system. So the motor cortex through the corticospinal system allows us to discreetly place our foot so that we can negotiate in uneven and unknown territory or around obstacles. Corticospinal being the direct system, we've already seen that, and it's predominantly contralateral. So if I'm going to place my left foot, it's predominantly from the right cortex that occurs. The other major system that allows us to adapt is the cortico-rubrospinal. So both these systems are the more medial in terms of within the spinal cord. The cortico-rubrospinal is different from the corticospinal in that it influences the whole limb. So it influences both the proximal and the distal of the limb, whereas the corticospinal is particularly about the foot placement. And it occurs throughout the swing phase and stance phase, whereas the corticospinal is much more involved in the swing. It's much more discrete to the swing phase and the placement of the foot through the swing phase. And there's the cortico-rubrospinal. Vision is obviously really key in terms of our ability to adapt within the environment. And we know that if we have vision of an upcoming obstacle, we actually start to adapt our gait cycle 4 or 5 steps before we get to the obstacle. However, if we don't see it until the last minute, we can use vision within the last step. And so then clinically, in terms of adaptation, you want to obviously assess whether the patient can adapt to the environment and step in different directions. As I said before, you might ask the question, which direction should you first step? Is the challenge to their discrete foot placement about the whole limb or the distal aspect? And can the person negotiate the environment in a continuous flowing locomotion or not? And lucky last to say that, so we have neuroscience there, and we have there's a huge amount of information in terms of locomotion, but the essence as clinicians is that we have to take this information and use it to make clinical bridges to treating our patients. And it's up to us to make those clinical bridges from the science. The end. Okay, so you get a break. Need a break after that.